Science continues to advance at an impressive pace in most sectors of society. Today, we can already see cars parking themselves, machines that are able to pack food on their own, and even robots that are beginning to perform increasingly challenging activities while assisting humans. Don't believe us? Just stay tuned for today's video, and we'll show you a marvel that will revolutionize the field of medicine. If you're wondering, what can robots do in this field, and how can their accessories, programming, and parts be used to improve people's health? Then you've come to the right place. For many years, engineers and doctors have been looking for ways to implement high-tech machines in explosions so that they can perform activities that, even for a human, can be difficult to do. As you know, not everyone is born with the pulse or dexterity of a surgeon, but thanks to a new development, it looks like we may soon see a different breed of personnel on operating tables. Let's learn more about this technological breakthrough. We could say that technology and medicine are two fields that have coexisted for several years now. Thanks to the advances that have been made to develop cures for certain diseases, people have enjoyed a better quality of life, allowing them to take care of other aspects of their being that were neglected by other generations due to the lack of certain treatments and cures. Yes, the discoveries with penicillin and other antibiotics, as well as tomographs, X-ray machines, and others, have revolutionized at some point in history by their discovery, manufacture, and the use they have been put to help protect people's lives. Technology has become an indispensable ally for the health sector, and that is why, when it was first proposed that artificial intelligence could be created with sufficient capacity to assist a doctor in surgery, many doctors and specialists in the field won the event. As you know, today, some robotic arms and high-tech devices are used to improve the accuracy of the doctor on call while reaching those places where he couldn't enter before. In times, operating in this way is already an indispensable requirement for doctors, and many patients feel that they can trust the capabilities of these professionals thanks to the same factor, which improves the quality of the intervention, together with their precision, speed, movement control, and ergonomics. Undoubtedly, all these points make it possible to minimize hand tremors and fulcrum effects to considerable levels, while taking advantage of the device's multifunctionality. However, while certain devices and accessories have become indispensable for minimally invasive surgery, many such procedures have shown that the robot in turn requires almost total access to the operating table. Whether through multiple docking ports, or by taking over the site, leaving the surgeon with very limited maneuverability, but the machines have been taking up more and more space in the operating room, displacing the doctor in some activities. In addition, the fact that machines have become increasingly complicated to operate, with a challenging and unintuitive interface, is causing many healthcare specialists to distance themselves somewhat from these advances, while still relying only on what they have mastered. Are doctors right to rely on these robots, or do they need to upgrade to continue to offer their patients first-rate treatment? The second question seems to be the more accurate one, or at least they have proved so, thanks to the most innovative advance ever made in the field of medicine. Today, we can say that the first and only robot authorized by the FDA to assist in a procedure in its entirety already exists. Thanks to its humanoid-shaped arms and the ability to mimic the movements and precision seen in the arms of top surgeons, this AI is able to provide very similar surgical treatment without sacrificing factors such as ergonomics, speed and reliability, comfort, and attention to detail. The device has sparked a debate among doctors and healthcare specialists in various parts of the world, with some believing it is too early to use such a robot, while others agree to start field testing it. From what has been revealed about the robot, it is known that Hominis was designed with the same capabilities found in a surgeon's arms while maintaining an acceptable cost and occupying a reasonable storage space. The Hominis robot-assisted transvaginal hysterectomy surgery system from Memic Innovative Surgery Limited is the first robot that has the necessary features to perform the task of surgery. With an arm and joints that resemble shoulders, elbows, and wrists, the machine can operate with impressive precision, employing dexterity and mobility never seen before. As a machine designed with these capabilities, it can help people by bringing multiple instruments through a single portal. In addition, it is due to the joints themselves, which can take advantage of access and operate from various working angles, performing optimal and much more detailed work. Thanks to what we've already seen in the first block of the video, we can say that science has taken an important step forward in the field of medical interventions. In years gone by, it never crossed our minds to put our health and healthcare in the hands of robots. But now, we are starting to see a change in the population's thinking. Will anything change in the structure we already know, or will hospitals continue to function in the same way? Let's continue with the video. One of the factors that has attracted the most attention is the fact that the robot in question takes up less space than other surgical machines, as well as being much more affordable than other robotic systems. Humanoid does not require a large space to store or assist surgery, so doctors could operate while using the benefits of the device. Moreover, due to this cost reduction, several hospitals and ambulatory surgery centers have the possibility to acquire one of these marvels, to attend their patients and enjoy the benefits of a less invasive intervention. Due to its construction and the first field tests that have been performed, Humanoid received FDA marketing approval in February of last year. 2 hospitals in the US decided to use the equipment to implement the first procedures and were successful. Although the surgeries are focused on treating transvaginal hysterectomies, the robot is expected to make an appearance in other procedures in the future. Quote, "It is very encouraging to see the first hospitals in the US performing benign gynecological procedures using our Humanoid system. We are grateful for their support," said Dvir Cohen, president and CEO of IMMINENT. Humanoid is well positioned as a disruptive technology that will transform the way surgeons perform minimally invasive robotic-assisted procedures. With this last point, we come to the last part of this video. Although some members of the medical profession are still expressing their doubts on the subject, we can say that the general thinking is changing and moving in favor of this new technology that has come to help us. However, while some are pleased with the news, they can't help but wonder, what will happen to other doctors in the future? Will this profession begin to deal with artificial intelligence, or will a balance be struck between humans and machines? Comment on what you thought of today's topic, and if you would like us to touch on another topic in future videos, please leave us your suggestions. We appreciate the time you've dedicated to our content. Subscribe and support us with your like. See you next time.